Lead poisoning is entirely preventable. That's what you'll hear from both doctors and government leaders. But in Syracuse, each year, hundreds of children are still poisoned in their own homes.
Families impacted by lead poisoning are demanding more from the city to protect their children. Syracuse city leaders are hopeful a new ordinance could be a turning point. Our Connor White reports.
Bobby Boy Jr. is 41 years old. Pictured next to him is his sister Oceanna Fair. They see each other almost every day. It's out of love, but also necessity. Bobby needs his family's help with almost everything.
At the age of a toddler, they are robbed of their future.
Lead paint in their Baker Avenue home poisoned Bobby when he was 2. Almost 40 years later, he needs help to bathe, shop, and pay the bills.
Lead poisoning for my family has now become generational.
In 2018, her then 4-year-old granddaughter was exposed to lead paint in Oceanna's own home on Cannon Street, just 6 blocks away from the Baker Avenue home that poisoned her brother.
That red paint that you see under the gray paint is the lead paint coming through again.
She says they got no warning about the lead when they bought the house, but the county confirmed that this property is responsible for her granddaughter having a blood lead level of 17.1 micrograms per deciliter. It's over 3 times what the CDC in the state considers dangerous.
She began eating things that were not food, became very hyperactive, couldn't sit still.
It's a problem that disproportionately impacts low-income kids in Syracuse. The city accounts for just 1/3 of all kids under 5 years old in Onondaga County, but 9 in 10 kids countywide with elevated blood levels are in Syracuse. In some of the poorest census tracts on the north and south side, over 30% of kids tested have dangerous levels. Fair says since finding out about the extent of the problem, she's worked with a group called Families for Lead Freedom Now to try to address the uphill battle tenants face.
Someone can rent you a home that will potentially poison your child, and there's very little you can do to stop it.
State Attorney General Letitia James is suing Endzone Properties and owner John Kiggins, alleging his properties lead poisoned 18 kids, all of color, over the past 6 years. This property, formerly owned by Kiggins on Warner Ave, had 43 lead violations not disclosed to tenants, poisoning 3 siblings according to the lawsuit. It sits between Oceanna's childhood home and the one she lives in now, a handful of thousands of properties built before 1978 when the government banned lead paint.
We'll continue to take any help we can get, but we're going to attack this at a local level as aggressively as we can to eliminate these hazards.
Syracuse City Code Enforcement Director Jack DeShaw says a new ordinance could be a game changer. It makes lead paint a city code violation, giving more teeth to enforcement.
And we will pursue that the same way we pursue other violations, whether it goes to our Bureau of Administrative Adjudication for administrative fines and ticketing, or if it makes it all the way to city court or beyond that, Supreme Court.
The ordinance was passed unanimously by the City Common Council in July of 2020, but DeShaw says the pandemic slowed rollout. Today, they're still training existing codes officers to test for lead and are in the hiring process for key positions, including a manager for the program. DeShaw says once everything is in place, they can test for lead more often in more properties, as it's now a standard part of other routine code checkups.
We're talking, tens of thousands of structures in the city of Syracuse that we're going inside on already periodically. And we're adding the lead inspection portion of it and the violation check portion of it to those inspections.
DeShaw says his goal is to have this fully operational by next spring, hoping to find homes that have slipped through the cracks. Oceanna Fair says this is a start, but says she's looking for more legislation to come down, pointing to massive problems in housing regulations and how lead paint is actually dealt with once it's found. We'll continue to have reporting on this, looking into where testing is falling short and why some owners are having to repeatedly try to deal with lead paint issues they thought were taken care of.
The pandemic dramatically changed the school year. And now health experts say the approval of a vaccine for young children has the opportunity to make things a bit more normal down the road.
Our Vanessa Rizzitano spoke with some parents and is live in Syracuse tonight with what they're saying. Vanessa?
I took this topic to Facebook, asking parents in our local community what their thoughts are on this newly recommended vaccine for this younger age group.
Candace Fanning is a nurse who has been working on the front lines throughout the entire pandemic.
I just felt it was important to be part of the solution rather than part of the problem.
She tells me she's seen the devastating effect COVID has had on both individuals and businesses, although she got both of her children vaccinated.
And I don't think it should be a mandatory vaccine. It is new, and I understand that a lot of people are hesitant.
But she stands by her decision to get her 11 and 17-year-olds vaccinated. Not only does it protect her kids, but the community as well.
And these children could be walking around infected and might not even know it. They pass it on to their family members, their grandparents. So it's not just about my kids protecting themselves, it's about protecting everyone they're around, their classmates, their teachers.
Don Law from Syracuse just got his 6 and 7-year-old vaccinated. One of the many reasons his children are vaccinated is because COVID has affected their time in the classroom.
My daughter went down to the nurse. She has allergies. And the nurse said, sorry, she can't come back until she gets a negative COVID test.
That's something that I've heard from families before. Every sniffle or exposure is leading to time out of school for their child and time out of work for a parent trying to track down a COVID testing location and wait for the results. If a child is fully vaccinated, they won't need a quarantine every time they are exposed to a positive case. Law is hoping for a return to normalcy soon.
I mean, the kids are still wearing masks when they're going to school and everything. And if they can get enough people that are vaccinated, we can go back to normal.
Local school leaders I spoke with this week say there is a push to provide more information on the vaccine and inform parents on it as more opportunities are opening up for this younger age group. The Lafayette school superintendent that I spoke with yesterday tells me that his school is a little bit divided, with about 1/3 showing full support for the vaccine for this age group. The other third of parents are not so sure. They're kind of a little bit back and forth, and the other third are against it, and they do not plan on getting their children vaccinated.
Well, free COVID booster shots continue to be available statewide for eligible New Yorkers. Good evening, I'm Matt Mulcahy.
I'm Michael Benny. Thanks for joining us on the CW6 News at 10. There are now booster recommendations for all 3 COVID-19 vaccines that are available.
But are you eligible for one? Our Samantha Croston spoke with a public health expert who says there are many people who would qualify for a booster shot, but they may not know it.
On the state's COVID-19 dashboard, the groups of eligible people are split into 2 categories: people who should get the booster and people who may get the booster. Tonight, I take a deep dive into who may get the booster. And as you'll hear from the experts, it's more groups of people than you might think. According to the state's COVID-19 dashboard, there are 2 categories of people who may get the COVID-19 booster. The first, people ages 18 through 49 with underlying medical conditions. But as family doctor Matthew Cambereri explains, one category alone immediately qualifies most people.
One only needs to have a BMI, body mass index, above 25, which, unless you're at your perfect height weight, you're above 25.
The list of underlying medical conditions that qualify is lengthy, with 17 conditions listed ranging from cancer to diabetes to substance use disorders.
Unless you're someone who is in their early 20s, not pregnant, perfect body mass index, and never a smoker, you're generally going to qualify for the booster.
The other category of people who may get the booster shot are people ages 18 through 64 who are at an increased risk for COVID-19 exposure and transmission because of their jobs. Oneida County Director of Health Dan Gilmore says there are many occupations that would qualify.
Working at a grocery store, working as a bank teller, working the window of a ticket booth, or even as a volunteer getting out into the community.
Gilmore says that his advice to people who want a booster shot but are unsure whether or not they qualify is to talk to staff from their local health department. Those medical professionals are going to help them determine whether or not they're eligible.